Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I am very excited to have a very special guest today, Dr. Elisha Peterson. I will just give her a moment to give us an introduction to us about herself and her journey through medicine.
Hello, it is a pleasure to speak with you all today. I'm Elisha Peterson. I am a double board certified, actually triple board certified pain medicine physician. I am certified in anesthesiology, pediatric anesthesiology, and pain medicine. I currently serve at Children's National Hospital as the director of chronic pain.
Wow, that's a lot. Triple board certified. For all of the students out there, you have a long journey ahead, and all of you guys will become board certified very soon. The time goes by definitely in a flash, but Dr. Peterson, she just decided to conquer it all. So I'll ask you a little bit about pain medicine. Can you tell our students about the field?
Absolutely. So pain medicine is the prevention, evaluation, and treatment of patients who have pain. And the pain patients that we see are mainly chronic pain patients, so patients who've had pain for quite some time, pain that extends beyond what we would expect for a normal healing time. So what's really unique about chronic pain is it's not just a temporal extension of acute pain that many people think about. Oh, at the 12-week mark, it now turns into chronic. That's actually not true. Chronic pain has its own unique physiology, if you will, that underlines maintaining that kind of pain. And we know that pain affects every area of life, and the pain medicine physician works hand in hand with the patient on decreasing the impact of pain on their life.
That's so important because pain is so prevalent in the community, and they seem to go with each doctor, and it kind of affects so many different facets of life, and it can sometimes be debilitating. And as we know, there are different types of pain. What is your favorite method of pain relief for patients?
When we think about pain treatment, we discuss 5 buckets with the patient, if you will. One of those buckets we're all very common with, that's medications. Another is injections, certain types of pain that might be over a nerve territory could lend itself to an injection. Physical therapy is a method of pain treatment. Psychological therapy, specifically cognitive behavioral therapy, and skills-based therapy on how to use the brain to help decrease pain. Alternative modalities is another bucket, such as acupuncture. And then finally, area of pain treatment is surgery. However, we have to keep in mind that surgery is mainly to address functional impairments. It's not meant to treat pain. But if we find that a patient has pain from an entrapment of a nerve, for example, it may require surgery to treat that.
Thank you so much for going through the different types of pain management because, as you mentioned, everyone knows about option 1, medication. And a lot of times that is what the patients know and what they come to us for seeking. But there are a lot of different ways to manage pain that may actually be more beneficial for the patient. So I love that you mentioned things like the physical therapy and even cognitive behavioral therapy, because it's a lot of times those seem to be the last resort or something that a patient thinks a doctor may be not taking them as seriously for. And then when they actually try those modalities, they may find a lot of relief from it.
Exactly. So we present all of these options to the patient as appropriate, given what their clinical situation looks like. And families get to pick and choose what is best suited for them. And I then discuss with them, okay, choosing this option, this is what the road to treatment would look like. This is what the road to treatment would look like for all these different options. And because I specifically serve children who have chronic pain, we found that cognitive behavioral strategies and physical rehabilitation to be what really puts our kids on the road to recovery. And so chronic pain, as it relates to children, really is not a medication-based or an intervention-based kind of treatment. We usually look at those modalities if the pain is so severe in the child that they can't participate in cognitive behavioral or physical therapy.
That makes a lot of sense. Now we're going to kind of shift gears a little bit because I know that you enjoy talking about this. And as we've mentioned, you wear a lot of hats and you have 3 board certifications. So you're a pretty busy woman. But being a doctor is full of responsibility, but we also have to figure out those ways to maintain work-life balance. How do you do that?
I think that it's very important for your audience to know that work-life balance is not a real thing. It's just not. And we shouldn't seek that to judge whether or not we have a fulfilling, satisfying life. There are going to be times as you embark on this career that you'll be able to spend more time with family. There'll be times where you're going to be in the hospital a lot. The key is determining what is valuable to you and then making space to do that which is the most valuable. If you are in a relationship with someone, it helps having the conversation that the hours are not going to be regular in the beginning, and having a discussion up front of what the road looks like as far as engagement in medicine and time outside of the hospital. I think it's critical for also your audience to know that whatever it is that they really enjoy doing, their passions, their hobbies, keep it all.
Yes.
Do not stop doing those things you enjoy, because many of us come having dropped those hobbies, fully engaged in medicine, and then we realize after we're in it that this isn't satisfying me. Like, this isn't everything, So please keep your hobbies, keep all of those things that you really enjoy doing and make space for them, because that is how develop that resiliency. We talk so much about in the community about burnout. And people burn out because they're not engaged in those activities that are satisfying and fulfilling for them. So please continue to do those things you enjoy doing. That will improve your psyche, decrease stress, and really enhance and enable the care you provide to families.
Absolutely. I love that too, because a lot of times we think of life in black or white, work, life, this, that. You don't have to choose. Like, being a physician is wonderful, but it's not who you are as a person.
It's
a component of who you are. So you can be that partner, you can be that sister, mother, brother, dancer, whatever you are and you enjoy to do. Try to incorporate that and maintain that in your life. So if something changes and there's a time where you aren't able to work, some people do become disabled, or there's a time where you don't feel fulfilled by what you're doing. Like, life should be a period of engaging all of the things that you enjoy. And when life isn't fun anymore, you figure out what to do next. So I love that you highlighted that there isn't necessarily a clear cut and dry work versus life balance, but just figuring out what makes you you and keeping to do that.
Exactly.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
I do have a question for you. Since you work with students and you work with children in the hospital and on other things, what is something that you wish you knew about the healthcare system before entering it?
Wow, that's a loaded question, okay? I have to back up and contextualize this for the audience. I'm a first-year physician. No one in my family went into medicine, so I came into this, frankly, fresh, not hearing the stories, not knowing all the things. Mm-hmm. And I honestly thought, that being a physician, I would be my own boss. Mm. Oh my gosh. I thought I would have autonomy over my time. And that was the biggest joke. I work at a freestanding children's hospital, so I'm a hospital employee, and time is not my own. I'm assigned days and have patients scheduled on those days during the hours set by the hospital, and I'm to be there. And it's not completely like autonomous at all. So I think that was the biggest surprise, that unless you decide to embark on a model where it's private practice and you're the owner, that your time is being accounted for by other people. That was the biggest shock to me. And then I just want to also state that I thought that the system, as it relates to like healthcare delivery, would be encouraging of doing what's right for the patient. Mm-hmm. And it's not uncommon to be on the phone with insurance companies and fighting for a treatment that they have denied because of cost, or just because they don't have partnership with whomever and they decided they don't want to cover it. So the system does not make it easy for you to do what's right for your patients. And that was another surprise that I encountered on this journey.
I think that that's a surprise for a lot of people, because I believe that people assume that you're always looking for that finish line. So once I'm not a student anymore, once I'm not a resident anymore, my time will be mine. I will be the doctor. I will lead the teams. I will do what's right for the patient and what I trained for and what I took that oath for. But in the current structure of the healthcare system, there are a lot of checks and balances, and we're kind of a part of a system, and we have to figure out where we fit in. And a lot of times for people who are employed by organizations, it kind of goes along with what the organizational mission is or what this is. And you get into medicine and you're like, what about the patients? What about me? Mm-hmm. So that is definitely a shocker. And then I can totally identify with you about just practicing the medicine. Like, that's what we're here for. If the patient needs this, why can't I give them this? Why do I have to call and get prior authorizations and all of the credit words? And I can totally identify with that as well, because I used to work at a federally qualified health center where a lot of resources were limited, or patients did not have insurance. So you would know the treatment and know the management and see other patients who would get better with this, but you couldn't offer it to this patient because they didn't have the money, or it wasn't covered by their standardized system. Mm-hmm. So I think that is exciting for the students out there to listen and to look into what they may want to enter into the field, or if they want to get additional degrees like MBAs or something to kind of get more physicians in leadership to make those changes that will come down and help the patient.
Absolutely. And there's also a lot of different ways to practice.
Mm-hmm.
There's the rise of the locums, where the physician is essentially a consultant and can go on assignments across the country. And then they can say whether or not I'm going to do that or I'm not. There are just all different ways so many different ways actually to practice and serve in a way that you'd like. It's just a matter of being creative and talking with other people. There's so many different physician networks out there where people are customizing the way they practice, so.
Absolutely. So definitely do your research for when you're looking into what field you want to go into and how you want to practice, because there are some people who do hospital medicine. There are some people who do locums and they kind of travel around and have kind of an assignment for a month or two. And there are people who do direct primary care or own their own private practice or a micro practice. There are even practices popping up where you rent a space and you kind of share it, kind of like co-working centers. They're co-medical centers now.
Oh, wow.
So there are a lot of fun and innovative ways to serve. So it's great to try to explore that while you're still in this learning phase to figure out what best fits into your lifestyle.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
So my final question for you, as you've shared so many pearls of wisdom, is what is one piece of advice that you would like to leave to both pre-medical and medical students?
I would encourage the students to, as much as possible, actively work to live the life you think you want now. And I'm going to preface this with saying, for example, all of us prior to entering medical school had a vision, a dream. Some people think that being a doctor is having a scalpel in the hand and being under some OR lights. Some it is holding up a newborn baby and saying it's a girl. Everybody has a vision of what being a doctor means for them. And I strongly encourage to seek out that experience, identify an individual that is doing what it is you think you want to do, and shadow them. And when I mean shadow them, I don't mean just shadow them between the hours of 9 to 5. I mean actually have the experience, which would include being up when others are asleep. Because that is the real aspect of medicine that many people do not see, because, I mean, the stuff doesn't happen between those working hours. Get that experience early and be able to appreciate not only the patient-facing activities, but the non-patient-facing activities, the level of documentation that has to be done, and other stuff behind the doors that many people don't recognize that we have to do. I think by doing that, you'll be able to refine what you like and what you don't like, and it can also help just guide what kind of experiences you'd want to have moving forward.
Absolutely. That makes a lot of sense, because for a lot of people in the early phases of medicine, when you're shadowing, it is during work hours, quote unquote, but those are the 9 to 5 hours. So all of the action happens outside of that. So trying to figure out, if you want to be a hospitalist, what is it like to round at midnight? Or if you want to be in the OR, like what is it to go in at 5 a.m. when the cases are starting and everything is ripping and rolling and they're checking on the patients? So if you want to be a part of that lifestyle, it's great to immerse yourself and kind of pretend to be in that field for that day or that week or that month. And even when you continue and you're actually in your formalized rotations during medical school, it's okay even if you don't consider thinking that you want to be in that field, to go in with an open mind and pretend to be that doctor for that month or 2 months that you're on that rotation, because sometimes people have a change of heart and they may go in gung-ho that they're going to be a pediatrician and turn up becoming a orthopedic surgeon or something like that. So just go in with an open mind and try to learn as much as you can.
Absolutely. Physicians are problem solvers, and the key is to identify, well, what kind of problem do you want to solve? And the only way to get that experience is to actually go where the decisions are happening in real time, and to ask, why was that decision made? And what are the factors that this person is considering and that they have to consider day in and day out, both short-term and long-term? And that's going to help a lot, because if you love what you do, you don't have to work a single day, right?
Absolutely. Work should be fun or you shouldn't be doing it. So I really appreciate you taking the time to come and talk to us today. And I just want to give you an opportunity to say goodbye.
Wonderful. I appreciate being on this podcast. Thank you so much. If there's any additional questions, you can feel free to follow me at ePetersonMD at Twitter. I post things related to chronic pain. And then also too, if there are any additional questions surrounding pain medicine or pediatric pain, Children's National has a Rise and Shine blog. I post information there for parents. And a colleague of mine started a YouTube channel called Surgication, and it talks a lot about surgery and pain as it relates to children as well. So those are just some resources if you're interested.
Thank you so much. And to all of the listeners out there, we appreciate you for listening for this long. And I'll be back with you guys with another episode next week. Have a great week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.